Good afternoon, Dr. Rosenquist. This is Cody and Lynette's presentation for community health for our zip code 32254. Let's get started. Community health assessment is one of the three core functions of public health nursing. It is a process of critical thinking, getting to know the residents, and understanding the needs of the community. The main population in our zip code, 32254, is going to be white at a population of 5,288. African Americans, 7,146, so they're the dominant population in this zip code. American Indian and Alaskan Natives were just at 59, as well as Asians at 58, and Native Hawaiian and Pacific Islanders were the lowest at 16. There's also a high Hispanic or Latino rate at 869 as well. So that just gives you the general makeup population of our zip code for registered voters and who's walking around the community. 36.3% of the individuals are below poverty level. This is according to American Fact Finder 2017. The median household income is $26,482, which is way below the standard of living. Whenever we were driving around to do our windshield survey, most of the homes and businesses were either closed down, they were in severe disrepair, or they were just, the businesses were just completely empty and they were looking for pieces to be filled. In the state of Florida, we have an epidemiology team, and they help to work, identify, investigate, and manage, evaluate health hazards in the community. So they basically are there to keep track of STD rates, stroke, heart attack, anything like that that might be influencing this area the most. They provide information about communicable, reportable, and emergent diseases and conditions within the areas of the entire state of Florida, as well as Duval County and down to specific zip codes. This is how we keep track of the HIV rates, stroke percentage rates within the area as far down as county-wise. The team also serves the public and community partners such as the City Rescue Mission, Jacksonville Metro, Gateway, and Facilities of Care. We also have the Schultzbacher Center here that it's kind of like a homeless center. They take for long care homeless, and they also accept very, very low income for like prescriptions and medications that are going to be at extremely low cost. However, they only take like maybe 40 people at a time, and once they're filled, and you can't really get in. So there's a fight to get in there every single morning. And personally speaking, I've seen it. The services provided in this area, reportable disease investigation. So anytime somebody comes to the hospital and gets tested and reports a positive HIV test, that HIV test is reported to the county and the state pulls and looks at where that individual lives and sees what could have been the underlying contributions to that, whether it was poor health care, whether it was no access to primary care, whether it was preventative measures. They also offer hepatitis counseling, testing, and education, biosurveillance, and education consultation on infectious disease to professional providers and community groups. So these are basically given out to community members who are volunteering within the area, the professional providers and the community groups. And they go out into the area and spread information, give out flyers, hand out sexual preventatives to help keep STD rates and the flu down, basically, pretty much. Duval County is ranked first among large counties in the state of Florida for STDs between the ages of 15 and 19 years old. Duval's STD rate of 3,789 per 100,000 people is 37% higher than the average of the state of Florida's rate, which is 2,377 per 1,000 for teens 15 to 19 years old. So this is basically saying that Duval County is one of the highest rates for STDs in the entire state of Florida, which is very, very, very concerning. This is a map of all the health zones within Duval County. We have health zones 1 through 6, sorry. And our health zone is located right here. It's in orange. And it says Health Zone 1 has seen a decrease in students having sex before the age of 13, and a decrease in having, and an increase in having 4 or more partners, rather. Even with these declines, Healthcare Zone is still the highest for students who have had sex with 4 or more partners. Health Zone 1 has the most high school students being tested for HIV at 26%, which is incredibly high and completely unnecessary. We shouldn't have to have that many students that young being tested for HIV because of lack of preventative measures. Nearly 1 in 8 high school students report being forced to have sex against their will, and 1 in 6 experience dating violence. Health Zone 1 is the lowest for using drugs or alcohol before having sex as well. So this little area right here in Jacksonville, when we were driving around, it is not the safest place. There are many lower class working gals, I should say, that were noticed upon driving around some of the side streets. There were several students that looked like they should have been in school and they weren't. I did not notice any truancy driving through the area to help keep these kids in school, nor did I notice too much police presence. I didn't see too many police stations or see too many fire stations or any sort of rescue stations to begin with at all. Health Zone 1 out of the entire county has very low primary care. The closest that I was able to find, all of them were outside of the main zip codes. They would have been located right here or right over the border here. There was nothing really as far as primary care or physicians located within this area so that these people would have access to preventative measures and care and frequent assessments by a physician as much as they should have. Health zones, a little bit about them. They were created by the Duval County Health Department to track health initiatives and outcomes. The Health Zone 1 includes zip codes 32208, 32209, 32206, 32202, 32204, and 32254 as pictured in the next slide, which would be right here. Health Zone 1. Statistics from health. Place Matters 2013 report by the Duval County Health Department shows that Health Zone 1 residents have the highest stroke mortality rate, highest heart disease mortality rate, and the highest infant mortality rate in comparison to other health zones. And for the infant mortality rate, I didn't quite understand why, and Lynette kind of touched on the subject that there are a lot of very early pregnancies, a lot of teen pregnancies that would otherwise not be able to follow through with care and prenatal care and aftercare like that. So it kind of made more sense to me once she explained it to me. Residents in these zones also have a greater percentage of visits to the emergency rooms for many issues that can usually be managed through regular visits to primary care physicians. During the windshield survey, I noticed a significant lack of primary healthcare centers within the area. So these folks tend to not go to the doctor for a very long time until they're symptomatic of something. They will have EMS called on them, or they will just collapse somewhere and they will end up being swung through the ER. working at Baptist Medical Center, we see a lot of this. A lot of repeat people that just use our emergency department as basically a primary care for things simple as medication refills. It's not good whatsoever. This is just, again, the health zone 1 that we have and the surrounding zones as well, all the way up to 6. Residents within this area also experience asthma-related deaths at a rate that is nearly double the average rate in Florida and significantly higher than the national average. The death rate for COPD is 30% higher than the average rate in Florida, and this is also tied into not having access to primary care, being able to get prescriptions, not making enough income to be able to afford health insurance so that they can have their medicines and their inhalers and everything else that they might need. So they basically, the COPD, the asthma, the cardiac events, the strokes, all of those go unchecked for so long. And then by the time we're able to actually care for the person, by the time they're symptomatic and they come through the ER, it is basically just managing the symptoms at that point because they've gone so long without having access to any sort of medicines, albuterol, anything like that in order to control the COPD symptoms or to control their abnormal heart rates or stroke factors. You want to touch on the problems? Yeah, go for it.
Okay. So the main problem that me and Cody decided to focus on is the lack of access to primary care for the residents of 32254. Like he said, our zip code belonged to the Health Zone 1, and Health Zone 1 is considered the urban core of Jacksonville by the Florida Duval County. We have a high stroke mortality rate, high STD rate, and as well as teen pregnancy. So for our health, we decided to do a
So for the major problem here, JPP report states that there's a significant portion of health zone 1s that are considered food deserts, according to the Healthy Food Financing Initiative. Food deserts are defined as low-income census tract where at least 33% of the households are further than 1 mile from a grocery store. Whenever I was completing the windshield survey, I noticed several communities within the zone that had no access to full-service grocery stores within walking distance. Some were as far as 5 miles away from the nearest community. Not having access to healthy choices or healthy options are also related to the high stroke and high cardiac events in the area. When you only have access to fast food options or quick food options that are high in sodium and cholesterol by nature, diminished health will also follow over a period of time. So the teaching and learning strategies here, Lynette came up with a very good plan as well to kind of gather the community together and sort of start helping health-wise to kind of get the community healthier and everything like that.
So with everything that Cody touched on, the lack of primary access, we decided to focus on preventative care. Primary preventative care. Primary preventative care is described as to promote health and also prevent from occurrence of diseases. Like Cody had said, a lot of the residents in our zip code don't have access to primary care. Therefore, their symptoms get worse before they come to the ER. And by that time, that primary preventative care that could have been done goes out the window because they're already at their worst. As we all know, we are in flu season. So where do we usually get our flu vaccine? Access to our primary care, they tell us and hone us to get our flu vaccine. However, our residents, again, don't have access to primary care. Therefore, a lot of them will be going through the flu season without access to the flu vaccine. So with the health fair that we're doing, we decided to teach them about what